Hi, yes, my name is Garrett Lynch, and this is N582, Module 1. For this discussion, we're going to talk about learning theories. We're going to talk about how these theories can provide guidance, and they can also provide resources for nursing instructors to develop evidence-based curriculum. In this situation, we're going to talk about 5 different learning theories and how they increase and decrease behaviors. Also, how learning theories can be used in combination to change behaviors, and then through the examples of 3 scenarios, we'll talk about the integration of these theories in these scenarios, real-life scenarios. First, we're going to talk about 5 learning theories and how this can increase and decrease behaviors. Okay, so the behaviors learning theory actually can increase behavior by doing 2 different things. You can use associative conditioning, which is it's the idea of Pavlov's dog. It's a neutral stimulus paired with an unconditioned stimulus leads to an unconditioned response. And you can also use operant conditioning, and this is where we use positive reinforcement, like good job, when someone does something that we want them to continue to do. To decrease the behavior with associative conditioning, you can take away the pairing between the neutral stimulus and the conditioned stimulus, or the unconditioned stimulus, and once that's done, then there will no longer be an unconditioned response. Or you can make sure that the unconditioned response does not follow the conditioned stimulus. You can also use operant conditioning, and you can use punishment in this case. If someone does something you don't want them to do, you can punish them, and that will stop their behavior. When we're looking at cognitive behavior, what we're really looking at here is cognitive learning disorder, or not cognitive learning disorder, cognitive learning theory. We're looking at how a student or a person actually acquires information. Because in order to actually teach someone how to change a behavior, you have to understand how they actually think. And so this has to do with information processing and cognitive development. So it really has to do with how they think, and then we can actually teach them how to change a behavior. The behavior doesn't change until they actually understand why they're changing it. This can be to increase a behavior, to get them to do something we want them to do, and also to decrease a behavior. Next, we're going to talk about social learning, and in order to increase the behavior, we also want to develop their self-efficacy, this sense of how they can be efficacious in their life and make the right decisions, and also look at good modeling, provide them with a good role model. That can also help them to change certain behaviors and increase certain behaviors. We want to decrease behaviors. We can look at the student or a patient may have poor coping skills, and so putting them with someone who actually has better coping skills or has better study habits will help them to actually become more effective at what they're doing. You can also help them to develop self-efficacy through the exposure to someone who also is self-efficacious. When we're looking at psychodynamic learning theory, we're looking at increasing behavior by helping the patient to develop what's called the ego, and this is kind of like a supercomputer that basically makes decisions based on what we call the superego, which is your natural desires, like for sex or for things for pleasure, and then also the superego, which is this idea of morality and decisions based outside of self. And so this supercomputer, the ego part, can actually make decisions by kind of looking at each individual case and then making a decision. When you want to increase a behavior, you want to increase the strength of ego, because then people can understand the long-term ramifications of their actions. To decrease a behavior, you also want to you want to develop that ego, because that helps them to now make less decisions that are based on immediate pleasure and more long-term decisions based on morality and based on the long-term ramifications of what they do. We're looking at the humanistic learning theory. We're looking at increasing behavior through satisfying basic needs, and these are what we call Maslow's hierarchy of needs, and these are going to be like for food, for satiation, and also for pain control. When we can manage those issues, then and develop rapport with the patient or student, then we can increase the behavior. When we want to decrease behaviors, we can do the same thing. We satisfy the basic needs, and we notice that the behaviors will decrease. Learning theories in combination. A lot of times when you want to get someone to change a behavior, you can recognize you want to develop rapport first, and you also recognize that these people are emotional, have their basic needs met, strengthen that ego so that they feel strong enough that they can make decisions that aren't going to just be based on pleasure-seeking things. You also want to help them to develop the sense of efficacy, that they can actually, self-efficacy, they can do it. And then you want them to understand why they're changing behavior. And then essentially after they understand all these things, then you can offer positive feedback as a form of operant conditioning to get that behavior to stick. The first scenario we're going to discuss is you are a staff nurse preceptor and you find that the nurse orientee you're working with has difficulty understanding the idea of titrating drug dosages on the basis of physiological data. And this is a weakness in which type of learning and what might be the underlying problem? Well, this isn't a weakness in cognitive learning theory, and this is a weakness specifically in information processing. In order to help the student, there are questions you could ask. You can ask them how they believe they learn, describe what they're thinking as they learn, and during this you'd want to pay close attention to the learner's mistakes and also watch the learner's inability to remember or demonstrate information. For scenario 2, where you are preparing a counsel a nursing student who's failing a nursing course, how would your approach differ if you were basing your counseling on self-efficacy theory versus attribution theory? Well, attribution theory is this idea of cause and effect. It has to do with this distorted attribution of what the student believes about themselves, and that's what causes them to fail. So you have to help them to kind of recognize that they internalize these beliefs and help them to actually change the belief system so that they can actually believe that they can be successful. When we're looking at self-efficacy theory, we're looking at this belief that they actually are successful already, and so you can actually look at how successful they've been in the past and how they've done in the course and how that can be applied to now. The last scenario is you are a clinical preceptor in a healthcare agency. How can the social cognitive theory assist you in teaching your preceptee how do social factors affect perception, thought, and motivation? Well, when you're looking at social cognitive theory, you're looking at social class, gender, family life, life history, self-concept, and learning situation, how these all influence individuals' perceptions. You want to kind of ask the student a lot of different questions about what are their expectations, what motivates them, how do they perceive, what's their metacognition, how do they learn. Those may be all important to helping to kind of get an idea of how this person is actually acquiring information and how they may be more effective at learning. For my conclusion for this video, I want to look at it's very important to apply learning theories to teaching, because you can actually look at so many whole parts of the learner themselves, and you can really effectively focus on their background, what motivates them to learn, and their emotional place at the time of learning, and also recognize their thinking processes, and this allows you to be a more effective educator.